Hi, John. It's Alex. Would you like to do a bit of an introduction? Thank you.
Yeah, thanks very much. Afternoon, everybody. Welcome to this week's exec update and Q&A. Looking forward to a good conversation. I've got Clare, Teeney, Director of People and Culture, with me today from the exec team. So as ever, I'll start with a sort of an introductory overview of where we're at, and then we'll come to some of the written in questions first, and we'll take it from there. So where are we? Well, it's really, I think it's important to start with a commentary on the day of reflection yesterday. We're a year in, and I know that across the trust, a large number of people were involved in just taking a bit of time to just think through and reflect on what we've been through in the last year together, and to reflect, I think probably across the scale, from some of the wonderful work, passion, involvement that we've seen across every service has been truly inspirational and uplifting, and making sure that we capture some of the things that are working really well, and leave behind some of the things that we've forgotten that we did because they were so bad, and we ask ourselves, why do we keep doing things like that? And we've got a lot to learn from that, and we need to make sure that we enable people from right across the organisation to be able to contribute to that in things that we learn during the year. And then at the other end of the spectrum, the trials and tribulations that so many people have gone through, not just in their work life, but in their family and personal life too. And in some cases, the sadness around the ultimate sacrifice that people have made. We've been fortunate, if that's the right word to use, from an organisational perspective, that the number of people that we sadly lost has been relatively small, although these are individuals and people and families, and that impact of loss will continue going forward. In comparison to some other organisations, it's been fortunate, and we see, don't we, on a regular basis in the news and even locally within our region, the toll for health and social care staff has been really significant. So just wanted to take a few moments to sort of join that reflection, really. Looking forward, we're in a good position organisationally. We've got the uplifting news from the National Staff Survey. I'm not sure if I mentioned this the other week, how well we did, being the most improved mental health learning disability organisation and community trust organisation in the country. What a great place to be. And again, it's really important that we pick that up with everybody to identify the important bits that we can say, okay, this is flagging. What are we going to do to continue the improvements that we're making? So that's obviously an important priority on our agenda. Closer to home in terms of the day job, just wanted to give an update on the vaccination programme. You'll see in the media, of course, that it's going really well, isn't it? Nationally, over half the adult population of the UK has now been vaccinated, and I think the important thing that's starting to emerge is, for the first time, there's been that break between the rate of new cases and the relative rate of people, therefore, that get admitted to hospital, that end up in critical care, and then the number of people dying. And I think what will increasingly become apparent is that although there may be a sort of a baseline rate of new cases that might not go down and might sort of go up and down depending on outbreaks. The actual rates of admission and the rates of death will continue to fall. There's some emergent research and data around the vaccines actually starting to reduce transmission. It's not the only thing, obviously, that's reducing transmission. The social distancing, the lockdown, the PPE use is all reducing transmission, but there's some good evidence now that the vaccines are starting to contribute to that as well. And that was one of the unknowns at the start of the vaccination programme. More locally, in terms of our staff access to vaccinations, we've got a really good rate of coverage overall. And just to continue to encourage and urge people, if you, for whatever reason, people have felt a bit hesitant or unsure about getting the vaccine, it's never too late. You haven't missed any slots, and there will still be availability of vaccination for all our staff. And we've got a whole suite of data information, frequently asked questions to hopefully provide some assurance if people are still unsure. And so if people are unsure and they're thinking about getting it, get in touch, and we're happy to help have that conversation with you. In terms of our patients and service users, and again, not wanting to overwhelm everyone with loads of statistics, but one of our most vulnerable patient cohorts are those with serious mental illness, or SMI. The national rate for coverage of that is currently about 52%. We're within our catchment, we're at 57% currently. So it's tricky in terms of identifying who these people are. There are different classifications and descriptions of what SMI is, and for obvious reasons, often related to their circumstances and their illness, that they may be reluctant or have difficulty accessing the vaccine. So it's a really important piece of work that we're well on with, and we'll continue to make sure that we provide this facility for them. So that's we're in I'm pleased with the position we're in, and we've got a really good emerging process about how we enable those numbers to access it to increase. So another piece of good news. And as I've mentioned the last couple of weeks, increasingly start to talk about non-COVID related things. So, and again, it chimes, doesn't it, with the sort of where the national conversation is in terms of what's next, what does back to normal mean, if ever we will go back to what it was pre-COVID. It's about adapting to having the virus within our communities, and making sure that we continue to adapt to manage that safely for both all our staff and for our patients and service users. But increasingly, certainly NHS world will start to pick up the threads of some of the traditional things that we do at this time of year. So there's the end of financial year coming to bear in terms of managing the accounts, being accountable for our spending of public money, and getting our plan together for next year and our longer term strategy about the fundamental questions of what is NOTS healthcare for, where are we focusing our work to make sure that as many people can appropriately benefit from our broad range of brilliant services. And those conversations will be occurring at the same time. Two other really important things. One is making sure that we continue to prioritise the health and well-being of all our staff, given what everybody's been through over the last year. That's a really important piece of work for us, that we learn from the last year, and that we start to describe how services are going to adapt going forward and increasingly work collectively as a system. There's been some really good examples of that over the last year, and that's one of the things that we need to make sure that we nail down for the future. So that's me in terms, by way of summary, Alex, to kick things off, and happy to hand back to you to start to pick up some of the Q&A. Thanks.
Oh, thanks, John. Just to highlight that Catherine Concha has put something within the chat, just to highlight an event that's happening, which sounds like a fantastic event. Alex Manners, My Life Living with Asperger's, and there's a link there and a connection for anybody that wishes to join that. So that's thank you for that, Catherine. Moving on to the questions that have been sent in, and so the first few questions, if I can ask Claire, that would be great. And there's a bit of a theme to them as well. So Claire, just to ask the first question, how does the Trust stand on shielding members of staff returning to work in an office that has an unvaccinated member of staff? Thank you.
Hi, thanks Alex, and thanks for the intro, John. I'm Claire, Director of People and Culture. Thanks for joining us this afternoon and for sending in the questions. And as Alex has indicated in the chat, if you have things that you do want to raise, then please do so and put questions in the chat or come on and ask them, and we'll be happy to try and answer those for you. So in terms of people returning to work who've been shielding and returning to a place where somebody has not been vaccinated, there's a few principles about coming back to work if you have been in a shielding position. And we know from the information that we've got that we've had about 113 people across the Trust who have been shielding and are now receiving information about their ability to be able to return back into workplaces. You should have received an email from the Staff Health and Wellbeing team with some details on about returning to work. If you haven't, please get in touch with the Health and Wellbeing team so that we can get that information to you. But generally, the principles about returning to work are that it needs to be safe for you to do so. So there should be a risk assessment that takes place, and that should happen whether you're returning to work in an office environment, working in the community, however that might be, so that we make a risk assessment about the actual job that you do and the places in which you might work. So that's the first thing about what should happen there. Other things still need to remain about people returning to work and people being in work, and those are around continuing to wear PPE, continuing to adhere to social distancing rules and cleaning workplaces, etc. So as John said in the introduction, there's increasing evidence that the vaccination is helpful in reducing transmission rates, but the vaccination isn't the only thing that we need to rely on in terms of managing our response and our continuation of living with COVID. The other things that we've put in along the way remain important. And the vaccine as it stands at the minute is not mandated. We are encouraging people to have the vaccination if they haven't had it already. It is available to health and care workers, so colleagues working for the Trust are eligible to receive the vaccine, and we would encourage everybody to have the vaccination. If you haven't had it already and you've got questions or concerns, then again you can talk to the Health and Wellbeing team, and you can also talk to your GP. I suppose the short answer, that's a very long-winded set of responses to that question, but in short, returning to work because someone hasn't had a vaccine in an office space is not the reason that it will make something unsafe for you to return. It's about making sure that you take all of those other steps before indeed you do return to work. And the final thing that I would just say on that is that for shielding colleagues, you will have been out of the workplace for some time. And returning to work safely is really important. It's also really important that you're supported to reconnect with the organisation, the work that you do and that your colleagues, and so you should have that conversation with your line manager and your team members to ensure that your whole return is enabled and supported as well as it can be. I hope that that helps.
That's great. Thank you ever so much, Claire. There's a similar question, but just in case you wanted to add anything. The question is, please can you advise on the rules surrounding sharing office space after the 31st of March? My understanding is that staff will no longer be expected to shield. Therefore, will the rules also change regarding sharing office space?
So sharing office space, the rules haven't changed on that actually, and the position as it stands at the minute is that if people can continue to work from home, then actually they still need to do so, and that office spaces should only be shared where it's safe to do so, i.e. there can be reasonable distance, it's well ventilated, those sorts of arrangements put in place, and a number of workplaces across the organisation have ensured that colleagues are able to rota and do all of those things so that we don't have any overcrowded spaces. I think the other thing that it's important to say is that whilst we've never mandated that people have to work from home, we've encouraged people to do so where they can. What we've also said, though, is that as an organisation, we do have a large amount of estate, so we can facilitate people being on trust premises, but it might not be their usual place of work or the same space that they occupied previously.
That's great. Thank you ever so much, Claire. And again, linked to shielding members of staff, we have not had much information regarding the end of shielding for staff members, specifically those of us who visit patients in their own homes who may not be able to socially distance due to their illness, and visits can be quite lengthy and not COVID secure other than the use of PPE. Guidance that has come out over the last year tends to be more focused on inpatient settings. There's a follow-up question to that, but I just wondered if you wanted to address that one, Claire, please.
Yeah, so the same principles apply in terms of we need to do a risk assessment around the specifics that are being raised there, because whilst shielding is no longer being advised, actually there are other principles that are advised about keeping people safe. So as just to reiterate what I said in the first sort of response, really, all work situations need to have appropriate risk assessment undertaken so that we can enable people to work in a safe and appropriate way, and that's what would need to happen in that particular set of circumstances.
Thank you ever so much, Claire. There's the other question from the lady that sent this in this morning. Also, is there any guidance on returning to work once vaccinated? It's been quite vague how long before vaccines are effective on both the first and second doses, with differing thoughts on a week to 3 weeks. I know that's something that you were talking about earlier, John.
Sorry, just pressing the right button. Well, I'd refer to sort of Claire's answers, really. The conversation about returning to work isn't dependent on when you had your vaccine. The conversation about returning to work is making sure that you've had a risk assessment and you had a conversation with your team leader, line manager, if you've been shielding. So we're not going to be specifically saying you can't return to work until X weeks after a vaccine, because it's, as Claire said, it's not just about the vaccine.
Thank you, John. Claire, sorry.
Thanks, Alex. I just want to add in that we'll put some additional guidance in the daily comms from John, and just along with some information to signpost where people can get some more details and have some further conversations, the specifics of their circumstances confidentially, because that might help clarify a few other points. I'm just conscious we're talking quite generically, and I think it'd be really helpful to make sure that people can talk through the specifics relating to their circumstances. And just a final point, if I could add it on vaccinations, is John has said we've done really well in terms of the uptake around vaccinations, but if you haven't had yours, then please do get it. We've vaccinated over 9,000 colleagues at Nottinghamshire Healthcare, which I think is really fantastic, given that vaccinations only started towards the end of December, actually. So I think that that's brilliant, given where we are. And we do still have some colleagues where that's outstanding, so we would encourage people to access that vaccination. And also a plea just to colleagues that work with us on the bank. You are eligible for a vaccination, and just looking at some of the details that we've got, I know that it is bank colleagues that are the ones that are probably not had such a higher uptake. So if I can encourage bank colleagues, and if you know bank colleagues that you work with, please do signpost them to get their vaccination. That'd be really helpful.
That's great, thank you ever so much. Moving away from vaccines, the question has been sent in. Do you think that the success of home working means we can look forward to a more flexible working environment when things eventually return to normal? I love that phrase, return to normal, whatever that will mean. Thank you.
Yeah, so the very short answer to that is yes. I think we can look forward to a more flexible working environment, although, as with most things in life, balance is the most important thing. So it's probably an obvious thing to say, but there are some services where we've got to be very clear about who turns up, the number of people that turn up, the variety of people that turn up at a set time, and ditto when they leave, such as wards, for example. It's like I say, it's an obvious thing to say, but there are other, there's a whole range of enabling services that we've got, haven't we? That in lots of ways, you don't necessarily have to be in a place to do the work. So I think there's lots of opportunity here to begin to describe a range of offers across the organisation that can incorporate this flexibility. So, for example, there isn't any reason why a number of people in certain roles have to be on the road with the rest of the country at 8 o'clock in the morning to get into an office at 9. If we provide the facility for them to be able to do that at home or in a different base, and that's a really important piece of work for us to begin to describe that. So that's the long answer to that question. Yes, it is a good thing to be doing, and we are getting on with it. I know Claire's got a hand up on this too.
Yeah, just a couple of points, if I could just add on that. So it's been really interesting, hasn't it, in the last 12 months, because we've been able to work in ways that would have taken us probably years to have planned through and got organised. So I think that that's been really helpful, because it's shown what it's possible to do and how we can be creative around things. I think it's also thrown up that some people really enjoy the discipline of being away from home and going into a workspace, working, and then coming away from that and leaving it. And other people enjoy much more fluidity around their choice and options. And for me, as an employer, it's choice is the key word, that we have a variety of jobs where people can make informed choices about what the requirements of that work is and how that can be undertaken, but that as an employer in the round, we have lots of choices available for people so that we can attract and retain our workforce, and that people can be kind of satisfied in terms of the work that they do, because I think different people, different things suit different people, so choice is key.
That's great, thank you ever so much. Mark, I don't know, I know you've put something in the chat. I don't know if you've got your hand up as well, if you wish to say, and seen the reply from John. So you may wish to comment on that as well.
John, yeah, you've just done it, so I know my place. I'll shut up. No, yeah, no, I just put the question in, but I thought actually I'll join the conversation. So yes, I think one of the benefits of remote working is the fact that you've got the flexibility, but also we've got huge geography. So if we can join meetings, it's just going to help the environment and cut down travel. And from what my experience is, it improves attendance because it's easy to get to meetings. So actually, if possible, could we work to a policy or something that says it should be an option that's available for all meetings, apart from research, of course.
Thank you, Mark. Claire.
And so, yeah, I was having exactly the same conversation this morning with Sarah Furley, our Executive Director of Partnerships at Notts Healthcare, around the same thing, that, you know, we were reflecting back about how we probably used to travel around the county on a day to be physically present at different meetings, and I think that was probably out of date then, and that was only 14 months ago. It's definitely out of date now, and that's definitely an option that we need. It does improve attendance. It does mean that people can flex into and out of different meetings as well, which also helps, because sometimes you don't need to be there for the whole 3 hours, do you? You can be there, you know, you need to be there for a smaller part of it. So all of those things, I think, come into the remit of flexibility and choice about how we do things.
Brilliant, thanks. And John, it'd be great to have the CEO at all our research meetings going forwards. Thank you.
I'll let you have that conversation again. Thank you. Moving on, then we've got a question going back to the vaccines, which is there is talk in the media about vaccine shortages. Can you confirm that everyone who has received a first jab, Pfizer or AstraZeneca, will receive a second within the time frame? Thank you.
Yeah, thanks, Alex. Really good question. There's been a bit of chat about that, hasn't there? The short answer is yes. There's sufficient supply to honour all second doses. More broadly, just a bit of background context to this, that there is I think the phrase that's used for national supply is it's a bit lumpy, which is Hancockian jargon for we can't be dependent on set amounts at the moment, and that's going to continue for the next 2 to 3 weeks, and then towards the end of April, we're back on to buckets of the stuff. So we just have to be a bit careful about managing the number of first doses that are provided over the next 2 to 3 weeks. And the related point, but the other thing to really emphasise is how much national oversight there is on this. And many systems are keen to proceed through the next cohorts. The next one is cohort 10, which is the 40 to 49s, which is a big cohort for this county, and will no doubt include a large number of our staff and hence their families. But we are under instruction not to go into that cohort as things stand, and we will be told when we can. That we have to rightly continue to focus on cohorts 1 to 9, which are those that are most vulnerable to the virus, and to be able to honour the second doses. So in terms of the supply that we've got at the moment, and that we know has been confirmed that's coming, we will be able to ensure that people get their second doses. And I know sort of there's also been an issue, I think, of some of our staff haven't been too sure when their second dose is, because they may not have got a reminder, but please check, because we will be able to make sure that you do receive it.
Thank you ever so much, John. Just to highlight that Tracy Orlandi has kindly put in the chat as well, and that really keen to hear from colleagues who have not had the vaccine yet, but would like to have a conversation about the vaccine with a healthcare professional, or ask any culturally sensitive questions, to please get in touch with the staff support team or complete the survey that went out in John's comms yesterday. So. We've also had a comment raised by R-Call. I totally agree with the benefits of us continuing to work remotely and of the efficiency of meetings by MS Teams, etc. I'm not sure if we've asked our patients if they would continue to be happy with a 5-minute call or whether they would wish to revert to level of face-to-face contact as before. I know what the population I work with would say. Thanks, John.
Hi, Dash. Great question. And my view would be that, well, I agree. I don't think we probably have asked sufficient patients and service users what their preference would be. I think there's a range. I think a hunch, probably a majority of people would say they prefer the face-to-face. And there are some groups, though, that we know that that like the Teams approach. So that there was quite a number of people that were feeding back that use IACT services, not just in NOTS, but more broadly, that again the efficiency benefits of not having to travel, being able to do online stuff that you could record and then go back to at your own pace afterwards was really helpful in from a therapeutic perspective. So again, I think it's us getting sophisticated in describing a range of options and choice that is the important thing. Thanks.
Thank you, John. Thank you, John. Claire.
It was just to add to that. I think it varies for different services and different patient groups as well, doesn't it? And individuals. We had some feedback from a number of children in our services and young people in our services and their carers, and actually there was variability there around what, you know, face-to-face and also the use of MS Teams. That people actually, in the end, it wasn't one or the other. It was about having the combination of both, I think, was where it landed. But I think it varies dependent upon the patient group, the services, and I think the key, again, I'll come back to the word, a level of choice where we can.
That's great. Thank you ever so much. Just to highlight that we've got one more question which has been sent in. If anybody has got any other questions, please do put your hand up or put the question in the chat. And I saw the photos of this as well, John, so in your wellies. But the question that's been sent in is what is Hope Orchard, and whether you can just explain that. Thank you.
Just to say, I've had so much ribbing about those Wellington boots that I've actually got a hole in. It's almost on a par with the cardigan conversation. And I'm almost minded to say, I'm not going to tell you.
Sorry, I apologise about the...
But I will, because I'm that sort of person. It's a great initiative, Hope Orchard. So it's a system piece of work which is really related to our endeavours as anchor organisations in being part of the community that we live and work in, to tackle climate change. Planting trees is a good thing for the environment. This originally started at Sherwood Forest Hospitals, but it's something that I think all organisations in the system are going to get involved in. Our trust has got the benefit of having a lot of open space and green areas that we can look to identify where we can plant some trees. So a few of us went down yesterday or the other day in the morning to plant a couple of apple trees with some of the staff and more importantly some of the service users at the Wells Road Centre. And the joke that makes me laugh particularly was that there were also a lot of old goats there too. But I got into trouble for saying that. The goats they've got in the field at Wells Road Centre are huge. They're like small horses. I never knew goats could grow to be so big. But it was great to be. It's almost felt like we're being let out into the open air and to have some chats with some of the staff that are doing some brilliant work down there, and also to chat to a couple of the service users who are really, you could tell just by their demeanour that this is something that is really important for them in terms of their recovery. And they were talking so positively about not just planting the trees, but the connection with being outside and with nature, and what was so beneficial. So it was a good thing to do. But watch out more broadly, because this will be something that the organisation is really looking to encourage people to get involved with. Thanks.
Thanks ever so much, John. And Claire's put into the chat as well. I won't mention that she said that your wellies had a hole in them, but she's also said huge thanks to patients and colleagues at Wells Road for their support with Hope Orchard planting on Monday, along with the Notts Healthcare Sustainability team. Absolutely fantastic team. So is there anything that either of you would like to say before we close the meeting? Claire.
Just literally a couple of points from me, in that following on from some of what John said at the start about some of that wider system working. So just to share that we are meeting later today with colleagues from NUH, City Care, Sherwood Forest, to share some of the staff survey feedback. A number of colleagues work into different organisations and have families that work across our complete health and care provision. So we're looking to see what things we might do collectively to support all of our colleagues. So I just wanted to share that and say that we'll bring back some more information on that. And also just in terms of yesterday was time for some reflection over the last 12 months, and we will be doing some more of that across the trust. There was a huge amount that took place last year, both in terms of work and people's personal lives. So we'll just be having a bit of a look back and a collective look forward over the coming days. So wanted just to flag that, and as ever to thank everybody for taking the time to join us and say thank you once again for everything that you're doing. Really appreciate it. Take care all.
Thank you, Claire. And Lynn Walker has just added into the chat, in relation to Hope Orchard, we'll have more trees available for planting this year through our partnership working with NHS Forest. If you are interested in taking part or your site will benefit from them, please contact the environment team. That's fantastic. That's great. Thank you ever so much, Lynn, for sharing that. John.
Yeah, thanks. Yeah, just to finish, and to thank Lynn and her team for their involvement in this work, that piece of work. It's a brilliant thing to be doing. So thank you, Lynn. Yeah, just two things that I forgot to mention in my intro. Apologies. I'll get told off by Yolanda, because the first thing she'll say is, did you mention this? The first thing, really important, it's you'll be aware, if you're not, you need to know, it's we've launched our Oscar nominations. There's 2 weeks to go to get your nominations in. So far we've had 128 nominations, which I think is a world record, and that's just in over 2 weeks. We've had a good spread across all the different categories. If you've not seen it, it's all on the Internet Connect stuff. But have a look and get nominating your brilliant people and colleagues and teams that you work with. And we look forward to a really good event. And then the final thing from me, just to note that it's National Muslim Women's Day on this Friday, the 26th, which I think is a really important piece to flag in terms of all the staff that we've got working in this organisation. So there'll be a load of stuff on social media. There's a tweet chat, and there'll be various blogs as well for people to get involved with. So just wanted to flag that up. And to finish by saying thank you to everybody for joining us today and for what you're doing. And have a good afternoon, and we'll see you. You won't see me next week because I won't be here, but we'll still be having the call. Thanks very much.
Thank you. Take care.
Thanks,
Thank
Alex.
you.
Thanks.
Bye.
Bye.
Bye.